I like the yellow spot behind your screen, which says the Health Security and Sovereignty podcast there. That is just exact. I don't think the question is whether we have this or we have that. The right question to ask in front of us today is, how can Africa get there? Okay, and that is, we have to wear our can-do attitude for our own health security and sovereignty. I mean, that is the only way that you can protect our own people and take our future into our hands there. Otherwise, my fear is that we do not come out of this crisis documenting the lessons, but rather we learn lessons from it. There's a difference there. We can document the lessons by saying that, look, this happened, we didn't have vaccines and whatever, like we did for Ebola outbreak. The Ebola outbreak in West Africa, we documented. We wrote all kinds of good reports. The World Bank had a report. I think all European prestigious institutions, public health institutions, the London School had a report, the Harvard had a report. The only report that I didn't see was a report from Africa describing our own issues. I mean, we were written about by others. So it was documented, and we shared those ones, and in the very good journals like the Lancet, the New England Journal, and stuff. Learning a lesson is if we really do something. And I think we are learning a lesson from this vaccine situation where countries are stepping up and saying, I want to produce vaccines. Even if you start doing the fill and finish, okay, it is part of the ecosystem. You are somewhere inside the ecosystem of vaccine production. The next time around, you add vaccine production. Then the next time you add vaccine knowledge creation. That is, you put youngsters on a bench and they start creating knowledge and information that will be used for vaccine creation there. So we have to start somewhere and not try to get everything before we start. There's a saying that you go to war with what you have and not what you need. I think we have to go to war with what we have, and then we make progress.